here at the KGI MSPA program, so the PA program here at KGI. All right. Are you able to see this pretty well there? Okay, great. All right, so just quickly introduce the program here. It's the Master of Science of Physician Assistant Studies here at KGI. This is our actual faculty list as of now. You can see me on there as the Director of Clinical Education. This is our mission statement here. We obviously want to create high quality PAs, and you can see some of the things that are important to us, which is leadership and diverse population serving. We know that there's a definitive problem with meeting the needs of diverse communities, and we want to make sure that our graduates really look like the people they're serving. So you'll see that mentioned throughout this presentation. This program overview looks a lot like what other PA programs look like. You can kind of get an idea of a clinical phase as well as a classroom phase. So for us, the clinical phase is 12 months, and the clinical phase 12 months, the classroom phase is 15. So most PA programs are somewhere between 24 and 36 months. We fall right there at 27 months. We expect to have 40 students, and we're enrolling here towards the end of this year, graduating in 24. So we're really excited about this and our first class coming in here at the MSPA program. But what makes us different here at KGI versus all the other PA programs out there, I think really just understanding the PA profession, the fact that, the PA profession is growing, it's expanding throughout the healthcare world, trying to meet the needs and demand that patients have right now to do so in a cost-effective way. So you'll see a lot of different PA programs doing different things, trying to make sure that they're meeting the needs in their community. And so KGI is doing the same thing. So what differentiates us is we're really focused on leadership and entrepreneurship, trying to make sure that we're making decisions in a way that benefits patients and does so in a cost-effective way, and preparing our graduates to do that. And again, you can see this commitment to diversity, equity, and inclusion. Knowing that the PA profession is about 80% white right now as far as PAs, we really want to make sure that we're trying to take efforts to change that. And we want to do that but through our admissions process, through our training, and then making sure our graduates really represent the communities they serve. This is our didactic phase. It's really representative of what you'd see in a lot of PA programs, but I think the key takeaway is to notice that it is very, very time dependent. It's a lot of credit hours in each semester. And you can see that in our program, we have a special emphasis on surgery and emergency medicine. If you look over on the right-hand section at the bottom, you can see there's a course dedicated to that. We know that about 50% of PAs now want additional training over and above the primary care basis that PA programs provide. And that's what we're doing here that's a little bit different as well, is to make sure that we're trying to give some extra training to students that have that interest. This is what a clinical phase looks like here at KGI. Really looks a lot like what you would see at any other PA program, in the sense that you're going out to clinical rotations, actually touching patients and learning how to do the job. If you look over on the right side, you can see that the didactic courses are really geared towards our graduate project that we're doing. So master's level graduate project while you're actually out on clinical rotations. Admissions overview, very similar to other programs in the sense that we do factor in traditional academic criteria, grade point average, things that you've done. And then you can see here we also have patient care hours, and then the centralized application for PAs that everyone uses. And we have a supplemental application as well to get to know our students better. And our admission preferences, really trying to do that thing that I'm telling you about, really trying to make sure that the underrepresented in medicine are getting actual preference in our program, as well as military service and the other areas that are underrepresented in PA service right now. And of course, we give credit to anybody that's been here already at KGI to make sure that they continue that course through for us. But really, the concept of PA world right now is of growth, expansion, and we want to make sure at KGI that we're really meeting the needs of this specific area and the areas we recognize that are shorthanded, which is diversity and leadership within the profession. So that's where our focus is right now. So that's really the focus of my entire talk, but I'm happy to take any questions that you may have if there's anything specific about PA in general or the PA program here at KGI.
Perfect. Well, thank you so much. If anybody comes up with any questions, please let me know, and then we'll ask it at the end of the presentation as well. All right, and up next, our next speaker will be Dr. June Kim.
Thank you so much, Janet. All right. So can everyone see that? It's the postback. All right. So little bit about our post-bac program. So KGI, as the name suggests, Keck Graduate Institute. We do have many graduate programs. And the courses that students take in this program are the same classes in terms of the Henry Riggs Applied Life Sciences. But this program is designed to help students to enhance their academic credentials for a competitive admission into med school, PA, and any of the other health professions. So you can see some of the highlights. I mean, these are pretty consistent for all post-bac programs. They are designed to help students to become more competitive. For our program at KGI, we really focus on the interdisciplinary graduate science curriculum. We have a lot of co-curricular and extracurricular activities for our students. The advising is highly personalized. And we're able to do that because we have around 60 students. And we have a very strong collaborative culture in our school. And this is true no matter which program you're in. So again, the post-bac programs for which I oversee are designed to help students gain admission into the graduate health profession they want to get to. So our curriculum, I would say the key words here are off-label use. And I say that because the courses are going to look a little unfamiliar to many students. A lot of the classes typically offered in undergrad are the straight foundational sciences like biology, chemistry, and so forth. But you can see from our curriculum on our website that many of them are names and actually the titles are quite long. So, but nonetheless, these courses are very valuable to help our students demonstrate to the admission committees, again, whether it's med school, dental school, or what have you, that you are prepared to be successful in a rigorous science curriculum. So here are a few of the popular courses that our students will take. Again, these courses will count towards enhancing your GPA from undergrad, because many students make some mistakes during their undergrad years. And so this is an opportunity to build upon that. Here are some volunteer opportunities. You don't want to spend your post-bac years doing only academics, because you need to be able to demonstrate that you can not only take courses, but then you can actually live a normal life. That means doing things outside of the classroom. So here are just some of the different activities that our students get involved with. Our students also can choose to continue, because our post-bac certificate programs, whether it's the post-bac pre-med or the post-bac pre-PA, it's a one-year certificate, but students have the option to come back for a second year to earn their full master's degree. And remember, that's because the courses, whether you're a certificate student or you're a master's degree student, you're taking the very same classes. So here's a couple of our alums and where they are today. Actually, I should find more recent alums for that. Here are some career pathways that some of our students have taken. As much as we would love to have 100% transition to med school or PA school, the reality is we have students take many different paths. So you can see here, some have gone on to industry, research. We have 6 students who have chosen to go towards a PhD route. We've had a handful of students go through the dental route. Public health, there's 1 student who went public health, and we had our first optometry student last year. So again, a lot of different options. Community is real big in our program. So you can see a few pictures of our students. We do travel and visit different med schools and PA programs. That is part of our co-curricular activities. And as the title of this picture, the slide shows, together is better. And that's because we have a very strong collaborative culture where students support one another as opposed to seeing each other as competition. Here are some of the schools that we have visited in the past. Obviously, in the past 2 years, due to the pandemic, we were not able to travel, but nonetheless, our students were able to connect via Zoom or online meetings. However, I'm happy to share that we were able to travel in person this academic year. And here are some of the PA programs that our students have traveled to. Here's a few of our alums, more alums, and you can see the screenshot of a virtual meeting. Virtual coffee and donuts do not taste the same as in person. I have discovered that. And one of the things that I want to convey is, again, when our students begin the program, they're a little bit more formal. They're more, I guess, reserved. But once they realize that everyone is their own, each other's support, they're able to relax and have fun. So here's a picture of them on a med school trip here, and then relaxing and having fun. Here's a few just emails I wanted to share. This is one of the things that I love about what I get to do. Students will keep in touch, send me some great news, such as this email. Here's another one. It's super rewarding, and I know my colleagues have many of their own stories and anecdotes to share. This is great, and we're able to do that because KGI is such a nice and small, intimate community. And this will be the last one that I share with you. And that'll do it in terms of our post-bac pre-med and pre-PA programs. It is designed to help students to be successful, to be more competitive when it comes time to applying. So here's some contact information for myself, as well as my assistant director and colleague, Alba Munoz. And here are some websites. Again, if you would like it, please email me, and I'd be more than happy to send some of these links to help you get connected. And that'll do it.
All right, thank you so much, June. Thank you, really appreciate you for that. And up next, we have Dr. Gail Oram.
Thank you so much. I'm really excited to present today to this meeting. And I had everything all queued up. And here we go. So I get to talk today. I don't know if everybody can see my screen. I don't know if I'm in the right mode here. Is this better?
Yes, we can see your screen.
Okay,
it's perfect.
Great. So I get to talk today about the Doctor of Pharmacy program. I am a pharmacist. I've been a pharmacist for many years. And I'm really excited about our program here at KGI. And I think it's really just serendipitous that I get to come after Dr. Kim as he's preparing students for PA programs and for medical school. And there's some synergy there between even the PharmD program, because our students get to interact together. And the main thing about the KGI School of Pharmacy PharmD program is that we prepare students to become pharmacists in action. In other words, administering vaccines, working in pharmacies, working in labs, working as public health officials, and helping our nation through many challenges that it experiences, and even on the global stage. So our curriculum is pretty much based on 4 main areas: basic sciences, clinical skills, professional development, and experiential education, so that when you graduate from the Doctor of Pharmacy program, you're prepared to pursue a career in pharmacy. You're ready to get into action. And our philosophy is to develop the knowledge, skills, and attitudes necessary to practice at what we call the top of the license. So this is pharmacists providing testing for patients, pharmacists providing not only the COVID immunizations, but all immunizations, advising other health professionals, being those medication experts. And the wheel that you see on this diagram on this slide is what we call our patient-centered care, or the pharmacist patient-centered care plan. And all pharmacists do this process to provide care to patients that is helpful for that patient based on the patient's need and not on the needs of the pharmacist to provide a medication. We do have a lengthy curriculum. We have a 4-year PharmD program. There are a total of 159 units in our program. So that ends up being, yes, roughly 40 units per year. So it's a very intensive program, starting with the first year all the way through the P1 through P3 years. That's the first year through the 3rd year are primarily didactic, with the 4th year being primarily out in the clinical realm. So you'll have all that 4th year to get experience. And the 4th year is a calendar year. It's not just fall, spring. It starts in May after that P3 year and ends in the next May. So the 4th year really is a calendar year and not 2 semesters. And one of the things that we pride ourselves on in our new PharmD curriculum is this introduction to pharmacy practice. And you see here these number of integrated series courses. And let me back up. They start with introduction to pharmacy practice, and immediately in your second semester in the pharmacy program, you start talking about physiologic systems and the therapeutics for those systems. So we don't wait. We want to immerse the students in caring for patients early, right? So that you get this experience. Another logistics is I find that students who are very interested in pharmacy always want to know, and that is you do the fall and spring of that first year. And what you don't see here is this little white line, that's the summer. And during that summer is when you do your community pharmacy experience. So that's the first rotation is in the summer between the P1 and P2 years. And again, for P2, use that year, and there's a little thin white line there. And that thin white line is you're doing a number of electives during that summer that are experiential in nature. And then finally, after you finish the recitations 5 and 6, which are cumulative, then you'd start that 4th clinical year. Another one of our big features in the PharmD program is that we have the PharmD certificates, and they are pharmacy informatics, which is PI, healthcare management, HCM, medical and clinical affairs, which is MCA, and medication therapy outcomes, which is MTO. And this is where students get an additional amount of courses, both didactic and experiential, to prepare them to go into these areas once they graduate. So you see those courses on the side there, 9 units of didactic electives, 1 certificate elective experience, and then 2 advanced pharmacy practice experiences. This helps students to have experience under their belts when they go to apply for jobs at the end of that P4 year. And this is just an example of when the experiences are, whether they are in the 1st and 2nd year program or towards the 4th year of the program. And here are some of the clinical and specialty sites where we send our students to. We're really proud of these opportunities for our students, that they get experience in various areas. And another thing that we really make good on here at KGI is our exposure to the pharmaceutical industry. And we have a number of those sites, industry sites in both Southern California and then also on the East Coast for students. And you remember the slide that I showed before, that pharmacists are in action? Well, for us to prepare pharmacists to be in action, we have to have PharmD students in action. And I like this slide a lot because this is one of our PharmD students presenting research at a local association meeting. And so, as Dr. Kim mentioned, we have a lot of co-curricular activities, health fairs, immunization days, service projects. Some of those are with some of the other students at KGI that are not necessarily in the PharmD program. So we have a strong interprofessional focus. We have smoking cessation training, immunization training, first aid and basic life support training. And there's never a dull moment. We really pride ourselves on having a lot of professional organizations for our students. And here you see some of our students at the WPE, or West Coast, we call it West Coast Pharmacy Exchange, where they participated in a quiz bowl, and they competed with other pharmacy schools. They do talks to local areas for other students, and they also train other students. And you can see that the student in the burgundy is preparing for an immunization day. Here are some sample employment outcomes. These are real students or real alums. There's a little bit of a change here where you see where it reads Viraj Patel. He is now the owner of his own pharmacy. So we've got a lot of really positive outcomes for our students. I just want to put a plug in for our pre-pharmacy enrichment program in the summer. We're looking forward to seeing you either online or in person. It's a great program, a great opportunity, and you get a chance to meet students and faculty and be on our beautiful campus. And then if you have not completed all the prerequisites, there are also summer courses at KGI, and we look forward to welcoming you then. So with that, I just want to thank you for your time and attention. And if I can answer any questions, let me know. Thank you very much.
Thank you so much, Dr. Oram. It was really great to hear about that. All right, up next, we have Dr. Carlita Warren.
Good afternoon, and thank you for this opportunity, and thank you for being here. My name is Dr. Carlita Warren. I'm the Assistant Program Director for the Master of Science and Community Medicine program here at KGI, and I'll share a little bit of information with you regarding the program. And so I'd like to first start with just defining community medicine and why it's important, because a lot of times, because this is fairly new, individuals want to know exactly what is community medicine. And why is it important to us? And when we think about community medicine, we know that it is the art and science of promoting health and preventing diseases and prolonging life in defined communities. It primarily focuses on the social determinants or the determinants of health and local health issues within that community, and focuses on improving the quality of care based on community-oriented primary care and the organization of healthcare services. So this becomes important because we want to increase access to healthcare. We also want to improve upon health or promote health equity. And we're looking to employ individuals who seek to promote not only this health equity, but also to raise cultural awareness and cultural sensitivity in our healthcare system. So I just wanted to give that brief overview first as we talk about our community medicine program here at KGI. When we think about the Masters of Science and Community Medicine program here, it is a 2-year, 54-unit program, and it prepares our students to be skilled healthcare providers and health professionals that are devoted to everything that I just said. So improving the overall health and well-being of individuals in a defined community, preventing illness and injury, and detecting treatable medical conditions early enough to avoid premature death and or unnecessary poor health or a poor prognosis of health. The MSCM students are from diverse areas, and they are also individuals who come from underserved and underrepresented communities who seek to go back into those same underserved and underrepresented communities. One of the unique opportunities for our program is that it is 100% online, so it is asynchronous, allowing students to be able to continue to work or meet the demands that they may have both personally and professionally while they are achieving their graduate degree. We also focus on community-based learning. So while they are in their second year of the program, they will go into the community and provide an intervention or enhance upon an intervention that may already be present in those particular community organizations. Again, the idea is that we are going to be improving health, lowering the burdens of illness, and reducing the need for medical care for many within that said community. And then we also prepare them for job readiness. And with this job readiness, it is based upon whether individuals want to go directly into the workforce and be qualified to work as a community medicine practitioner immediately, or if they're seeking to pursue advanced education as a healthcare provider, such as a medical doctor, a physician assistant, or a dentist, for example. For our curriculum, it's a 2-year program, as I've stated previously. And in year 1, all students will take foundational courses such as the Introduction to Community Medicine, Professional Skills Development, or Health System Sciences. In that same year, all students will take what we call our Capstone 1, and that is the capstone courses, both for the fall and the spring, that prepares them for their capstone experience in year 2, where they are going out into the community to provide, to assess the community, see what needs are there, and provide interventions or enhanced interventions that may already be in place. So they get the preparatory skills that are necessary in year 1 to be able to implement that into year 2. We also have 2 tracks for our MSCM curriculum, one being employment bound, where individuals will take community health interventions 1 and 2 for those who want to go and work directly into the community. And then we have our Introduction to Life Sciences, where students who are looking to seek advanced degrees in medicine, for example, or physician assistant, as we mentioned earlier, they would take the Introduction to Life Science courses. In year 2, all students again take foundational courses such as precision health and community health. change management, behavioral change, and leadership. And that course is really unique because it teaches the students, or prepares them for being these change agents and changing the landscape of how we provide healthcare to our patients, but it also gives them the entrepreneurial background that they may seek or desire in a healthcare setting as well. And then finally, the capstone 2 is where all students will participate in a community-based project where they will be in the community for the entire year of their second year, both fall and spring, assessing the needs of their specific communities that they've identified and providing interventions for them. Most students, because our students are coming from various areas in the country or portions of California, usually they will provide the community in which they are seeking to assess. However, we do have opportunities where we can help students who have not identified a specific community that they would like to help, and we help them find communities for them. But the idea is that they go into the community and participate in a community-based project as their culminating experience. When we think about the career outlook for someone who is in an MSCM program, some of the top potential occupations or career paths that a person could take would be to be a health director or a health and wellness director, a healthcare educator, a public health advisor, health equity director, or a community health researcher, for example, and advanced degrees for individuals who want to pursue higher education beyond the MSCM degree would be for medical doctors or physicians, as we see here, pharmacists, physician assistants, occupational therapy or physical therapy, a dentist, or a social worker and athletic trainer, for example. When we think about the types of settings that community medicine practitioners are employed, this is not an exhaustive list that you see here, but local community or local county health departments, clinics and hospitals, social service agencies, WIC centers, non-governmental organizations, safety net facilities that are facilities that provide services irrespective of health insurance status for patients, and then social or affinity group organizations are some examples of where community health practitioners may work. And I will end with a typical day for a community health or community medicine practitioner. Ideally speaking, as I've mentioned previously, assessing the community needs, securing the resources and the funding for program initiatives to meet those needs for community constituents, and then implementing programs to improve overall health and wellness outcomes for individuals in defined communities. And so if you would like additional information, please feel free to contact me as the Assistant Program Director, and my information is here, and I'm happy to answer any questions that you may have.
All right, thank you so much, Dr. Warren. Up next, we have Dr. Emily Quinn.
Hi, everyone. Janet, are you able to see my slides? Perfect. Excellent.
Yes.
So I'm Emily. I am the interim program director for the Master of Science in Human Genetics and Genetic Counseling program at KGI. And similar to Dr. Warren, I'm going to just start by giving a little bit of background about genetic counseling because it's not a field that many people have commonly heard of. So genetic counselors, we are health educators and advocates with training in both human genetics and as well as counseling theory and methodology. And we utilize our expertise to provide risk assessment, education, and support to individuals and families who may be at risk of having a genetic condition. We also provide genetic and genomic expertise to the larger healthcare team, including nurses, physicians, physician's assistants, other individuals that we work with. We also are involved in ordering and interpreting genetic test results and communicating the meaning of these results. So if there is a diagnosis in the family, who else may be at risk and how can we better connect the family with care? So we always think genetics equals family. So we're not just thinking about the patients in front of us, but the whole family that may be involved. So some traditional areas of practice have been historically in the prenatal reproductive sphere, as well as general pediatrics, cancer oncology, as well as general adult clinics. But we do have expanding areas of our subspecialties of note in the last decade. Cardiology, neurology, and psychiatry have been increasing, but really any specialty within healthcare, there is a place where you can see the benefit of having genetic counselors. Genetic counselors also work in non-clinical roles. So this may include genetic testing laboratories. There are GCs who work in business, marketing, product development. They may work as medical science liaisons. In the laboratory, we have a number of genetic counselors who do variant interpretation, as well as genetic counselors working in research roles. We have genetic counselors in public health. You name it, as our field expands, we are kind of popping up everywhere. So a little bit about our program. We are a program that emphasizes interprofessional collaboration, problem solving, and personalized patient care. Our program is dedicated to benefiting society through education, training, and development of innovative, culturally engaged, articulate, and caring genetic counselors who will serve the needs of individual patients, the healthcare system, and the bioscience industry. So our curriculum, we are a 21-month program, and the first year of the program is very rigorous with a lot of didactic coursework. So students are in person in Claremont for the first year of the program. And the courses that students take include genetic counseling in practice. So these are kind of the basics of genetic counseling courses, genetic and genomic principles. These are our more hard science courses, genetics and healthcare. So this includes our public health course, professional development. This also includes boards reviews. So genetic counselors do take board examinations at the end of graduation. All students complete a capstone project at the end of their training, and then everyone's favorite, the clinical field work. And that starts the year between the first and second year of the program. So year one is very coursework heavy. Year two, students are coming back about once every 3 weeks for classes, but are really spending the bulk of their time working on their capstones and in their fieldwork placements. So where are we sending students to? A variety of different places throughout Southern California, as well as we have virtual opportunities as well, especially given the last 2 years, there's been a shift in our rotation opportunities, given just a push where many people are doing things virtually after the pandemic. So here are just some sites. Many of them are clinical. We also have excellent industry partners. And some other things to think about how we feel like we distinguish ourselves at KGI from other genetic counseling programs. I think being involved within the Claremont colleges means that our students have access to a variety of excellent resources. Our location, we are in diverse Southern California. So not only are rotation opportunities diverse, but the patient populations that you will be serving are also diverse. We, just like many programs at KGI, utilize the flipped classroom approach so that much of the initial steps of learning happen outside of the classroom, either through pre-recorded lectures or videos, so that when you come to class, you are better optimizing your time spent with your classmates, with your instructors, to really engage with the material in a meaningful way. Dr. Fortini will be speaking next, but I always like to plug that our students have a very close relationship with the MSGDA program. And most of the faculty who teach in our program are genetic counselors and have specialty in their areas of expertise, as opposed to other genetic counseling training programs may not have that really tailored touch to the classes they teach to being tailored for training genetic counselors. And we are a relatively new program. We're on set to graduate our third cohort this May. And so we also love for students to be excited to make their mark in a new and developing program. So who should apply? We want individuals who want to combine their passion for science with direct patient care. to be on the forefront of personalized genomic medicine, to interface with testing laboratories in the biotech industry, and to work in a rapidly evolving field. We really do want lifelong learners because the jobs that you're taking, that our graduates are about to take now, will look very different than the jobs that they will be in 10 years from now, with so many, with just the advances of genetic technology and incorporation of genetic testing into more clinics. Our jobs are constantly evolving. And with that, I also just want to plug the Clinical Genetics and Bioinformatics summer program that we offer. That will be taking place virtually this year if you want to get your feet wet a little bit more in learning more about genetics and bioinformatics. And with that, that's my contact information as well as for Dr. Fortini's, and I will be happy to take any questions at the end.
Thank you so much, Dr. Quinn. Really appreciate it. All right, up next is Dr. Fortini.
All right, well, thank you for that great introduction and segue, because I am going to talk about our genomics program, which is the sister program to our genetic counseling program. Some of you may have just heard about genetic counseling for the first time, but for all of the people that can picture themselves talking to a patient, there are an equal number of jobs behind the scenes working with the data and actually making precision medicine a reality for patients today. So we used to always talk about this as being something that might happen in the future, but the really exciting thing about genomics is that it's actually the now. This is happening in children's hospitals and cancer centers and patient care settings all around the world now. So if you're interested in personalized and precision medicine and want to see how it works, if you want to be involved in developing the new genetic and genomic tests that get released to help patients live healthier lives, or if you just want to use big data to advance healthcare, the MSGDA program might be the one for you. So we do have some career options that perhaps you have never heard about. For all of our awareness of the direct-to-consumer genetics companies like 23andMe and Ancestry.com, there's a whole clinical genomics industry out there that is growing extremely rapidly that needs scientists to do the work interpreting the information that comes from patients to try to explain what's going on with their disease or disorder. And so that job is called a clinical variant scientist. You might also see it as a clinical variant curator. And these are the people that take that DNA sequencing data, look at it and try to determine if that information explains what we're seeing in a patient. And if it does, they'll write up a nice report, and that report will be handed over to a genetic counselor who can then explain to the family what this data means and if we need to change their healthcare management based on that data. So there are two different places where people in this job typically work. The first would be at an in-house group at one of these hospitals that has a genomics core. So children's research hospitals, cancer centers, and large academic hospitals usually still do their own sequencing in-house. And so they would have a team that's put together to take that data from the sequencing group, interpret it, and then hand it over to the patients. And so if you worked in one of these in-house teams, you would probably know the medical geneticists very well. You would know the genetic counselors very well. You'd work on patient cases, maybe have rounds where you hear about cases and what happens after the fact when this data is used to change their care. So that's one place you might work. The other place is for one of the companies, for the smaller medical centers who are going to mail away the sample to be interpreted. And so these companies are, a lot of them are based in California, and their names are like Ambry, Fulgent, Invitae. These are companies you probably never heard of unless you've actually had a genetic test, but they are the companies that specialize in genetic testing and data interpretation. So a sample would get mailed to you, you would interpret the data, write up a really nice report, and then email it on. And so for people who work in the industry setting, you might specialize. So we have an alumni who works as a interpreter for the Women's Health Panel at Natera. So all of the cases she gets has something to do with women's health, and that is her passion. or you might work at a company that specializes in cancer interpretation. So all of the cases you would work on would probably be in one cancer type, but you'd be working on patient data from all over the United States. Now, before COVID, I always used to make a big deal about this. This is a job you can do in your pajamas. Of course, we know a lot of our jobs, we can do a high percentage of them in our pajamas and work remotely, but this will not change after COVID. So these jobs are great if you need flexibility to live anywhere and work online. Almost all of the companies are remote or hybrid. So some of the companies meet together once a year for a big get together to know their employees. Some of them meet maybe once a month or once a week, but almost all of them, the vast majority of your day, you're working from home. That doesn't mean you're working by yourself. You're still in a very active team, but you would download your cases in the morning, do your analysis, upload your cases in the evening. So again, this is the scientist who would take the sequencing data and make a recommendation on what is going on in that patient. So another slightly related healthcare career is the genomic data analyst. So a lot of the same skills get used, but it's a little bit different purpose. So this would be someone who would take large data sets to discover trends about a disease state or some sort of patient population. So they wouldn't be focused on one particular person, but maybe might work on a large research group doing cardiovascular health. And so you have lots of data sets from many people that have a cardiovascular problem, and you try to make discoveries that could impact their care. So you might work at a large research hospital or at a biotech or pharmacy company that's trying to make these new genomic targeted medicines, or even some of the sequencing companies that have this as an add-on service. So companies like QIAGEN, GeneWiz, Illumina are places where people send samples to be sequenced. You can always, for a couple $100, add on interpretation. And so they have a team that works with whatever samples happen to come through. So I know someone who has one of these jobs and they love it because they never know what they're going to work on. Every day is something different. You get a new project, you can dive in, really understand what's going on, write up your report and your data and your figures, hand it off and do something new and exciting the next day or the next week. And again, so this is someone who wants to work with the data to make fundamental discoveries about the biological process. So how does KGI prepare people for these careers? Well, we have a program called the Master of Science in Human Genetics and Genomic Data Analytics. And it's a bit of a mouthful, but we wanted to capture the two sides of the coin, right? We have a strong foundation in human genetics, but we also give you the skills to manipulate data to make discoveries very quickly. And so we planned it to launch with our genetic counseling program. They're our sister program. So we are also graduating our third cohort this year. And we have that foundational coursework in human genetics, but then we add on the best of KGI that was already here, which are the applied life science courses to understand how the genetics industry works. You know, what does the FDA do? How do people work with companies to make these a product versus something that's paid for by insurance? We also add on a really innovative human genomics curriculum that we designed from scratch in the last 5 years. And so it's really very forward thinking. These are classes that were designed for these jobs in particular, and they are really unique to other roles that you might see at other universities. The other thing is you build your network right from the start. So you're going to have classes with the genetic counseling students, and you're going to have classes with people that work at these same hospitals. So you already have your professional network when you start your job. And so this is our structure. Like genetic counseling, we're 21 months. We have lots of science courses in the first year. In the summer, between year 1 and year 2, you do a paid internship instead of a rotation. And then in the second year, you'll do your capstone and your coursework. And so these are a lot of our class names, but a lot of them are shared with the genetic counseling program, which Emily mentioned. But I will want to highlight, though, that you do get the chance to declare concentration. So in your second year, if you're really interested in these precision medicine careers, you can choose to have clinical decision support as your concentration. And then you take 6 units of extra classes in either maybe human embryology, medical terminology. It's something that gets you ready to be working from day one in that healthcare career. We do have our experiential education sites on this slide. We have a lot of great relationships with the children's research hospitals around the United States. with companies that work in genetics and genomics, and also with some of our local cancer centers. And this list continues to grow every year. So I just want to highlight some of what our alumni are doing with their GDA degrees. About half of them work in these clinical variant scientist roles, most of them at a company, but a few of them at children's hospitals. But we also have 3 students who have decided that they were not done with school, and so they use their MSGDA degree as a launch pad for a further degree. We have 1 student who decided she wanted to become a nurse practitioner specializing in genetics because she saw someone doing that at St. Jude Children's Hospital, loved it, and made that her career. We also have someone who decided to go to med school, and I love this. I want more doctors to have more genetics and genomics training for the future of medicine. And then we also have 1 student who got really interested in data equity in genomics, which is a big issue in our field right now to make sure we're using diverse samples. And so she decided to get a PhD in bioinformatics at the University of California, San Francisco. And so with that, I will share my contact info, and I'm happy to take questions.
All right, thank you so much, everyone, for giving such wonderful presentations. I'll open it up to some Q&A questions right now. I saw in the chat that Ashley commented regarding the MSPA program. So Jason, would you like to answer just out loud for everybody else? Are there any exceptions to having prerequisites done within the last 10 years?
No, not at this time. 10 years is actually a fairly long time in the world of PA education, just because classes and information is changing so frequently in the world of healthcare. And so, 10 years is actually a pretty long time, but I always recommend that anytime anyone has a question like this about specifics, I usually recommend that you reach out to our admissions team to actually talk to them and get some direct feedback and guidance, because everyone's situation is different. But at this time, if just the broad scope would be no exceptions to the admission requirements at this time.
Perfect. Thank you so much. Are there any other questions that anybody might have? All right, I have a couple of questions for our speakers just to give everyone oh, I see another one. So for the PA program, can you be pending your bachelor's degree but have met all the prerequisites classes? Will we still be able to apply?
Yes, you can still apply if you're in process, as long as everything will be done by the deadline. Again, I would definitely recommend that you reach out for specifics to our admissions team, because they have all of the criteria and can actually guide you to help you from wasting any time or energy. So definitely reach out to them. Yes.
All right. One of the questions I think will be good for our prospective students to know: what advice would you give to a prospective student looking to apply for these programs? What do you think will make them a good candidate? I'll leave it all up to whoever would like to answer first.
I can go first. I always look for a personal statement with a good, authentic explanation of why you're interested in the career. We're looking to educate people who are going to not just go into healthcare, but also be leaders in healthcare. So we want to really understand, why is it that you think this is a good fit, and why KGI would be foolish not to have you. And so definitely spend some time making sure your personal statement really reflects who you are and why you're passionate about your future career.
I'll add on to that, because I frequently also say that the statement of purpose is one of the most important pieces for admittance to the genetic counseling program. And I feel like your CV, your resume tells us what you've done. Your statement of purpose really tells us that exactly it. What is your purpose? Where are you going? And in addition to, of course, the required course prerequisites, we really also value life experiences that demonstrate that you can handle crisis and conflict situations. We don't want people coming into our program and just totally burning out, because the sensitive nature of what gets discussed in our clinical visits can be quite taxing. And there are having crisis intervention experience and developing some of those tools really set students up for success when they enter their clinical rotations.
And I would just add, if I'll just briefly, that ditto to what Dr. Fortini and Ms. Quinn mentioned, that just contacting us, doing your homework can go a long way. As Dr. Laird mentioned, you can save a lot of time if you email us, pick up the phone. We're here to help. We're here to answer questions. And we can go a long way in helping guide you towards reaching your goals.
Perfect. Thank you. Dr. Warren, Dr. Laird, anything you would like to add?
I think a lot. I would echo a lot of what has already been said. For us, the interview, if you can really convey to us in the interview process why you have an interest in community medicine and what your goals are to make sure that we are putting the community first or the patient first in their healthcare would be really good as well. Just showing that you do have a desire and to be in a community atmosphere and to make sure that we are lowering the burden of illness and increased risk of certain illnesses or conditions, and increasing access to care would be important to emphasize as well.
I think that everything that everyone said has been very valuable. I think that really the feedback that's been given crosses over any program that you're going to when we're talking about graduate work. Specific to PA education, I think that it's a very competitive area of entry right now. And I would just say that, there's a lot of feedback out there and information that's trying to give you an advantage, but what it ultimately ends up doing is creating clones of the same application. And I would really suggest that, no matter what program in the health professions you go into, that you really demonstrate who you are as an individual and what you're going to bring to the people that you're ultimately going to serve at the end point. So you don't want to lose yourself in your application by trying to fit some kind of mold. You really want to demonstrate who you are as an individual so that we that are sorting through these applications can really get a sense of who you are as an individual and see the value that you bring and who you are. So really stress that, look to stand out in that way and not really try and fit a mold because that sometimes can be a negative in a way as well. So really want to make sure that you sell yourself in a way that's honest and you do so that we can see who you are.
Perfect. Thank you so much. I'm so sorry if I mispronounce your name, but Adinde, you have your hand raised. Please feel free to ask your question.
Okay, thank you. Thank you, everyone. Good presentation. I believe, can everyone hear me?
Yes, we can hear you.
Okay, and kudos, you did well with the pronunciation. Sincerely, I'm surprised on how you got that. That's cool. So I want to ask, actually, what got me attracted to your university is I saw a program on Facebook, medical device engineering, if I'm not mistaken. So currently, I'm a medical laboratory scientist by training. I work as a medical diagnosis sales representative for ISM products. We are diagnostic distributors in Nigeria. So we present Roche and or we present the MEC as well, and the Mindray and the other best-in-class diagnostic manufacturing companies. So we offer support services to clients and hospitals that are using this equipment in Nigeria. So my interest was in the medical device engineering masters, but this program sounds very interesting. So I don't know, with my qualification, I just have a first degree in medical laboratory sciences. Can I fit in on this?
So what I was understanding was that you were interested in our medical device engineering program and you wanted to see if your experience fits in with our program?
Yes, for this particular course, this particular program, yes.
Great. Yeah. Please feel free to email me. I put my email in the chat and then I can get you more information about our MSMDE program.
Okay, thank you.
Yeah, no worries. Are there any other questions regarding our programs here at KGI?
If I could just jump in.
Yeah.
So in our program, we actually have, I think 4 or 5 of our first year students were medical laboratory scientists by training before they started the MSGDA program. So if you want to talk to one of them, perhaps about why they chose MSGDA after being in a similar role, I'm sure admissions could connect you with one of them.
Yes, feel free to reach out to us at Dean Day, and then we'll connect you with an admissions counselor who can help you figure out these programs. And the same thing goes for everybody else. If you're interested in any of these programs, any of the summer programs as well, please feel free to reach out to me and I can connect you with an admissions counselor who can work you through all the application processes. It's a good idea to apply for summer programs as soon as possible, as summer is quickly approaching and some of our deadlines are June 1st. So that is also quickly approaching. You would need just your application, letter of rec, but a lot more information about each individual program will be found on the website. But thank you so much, everyone, for being here. I appreciate everyone for presenting as well. Thank you so much for your time. Please feel free to reach out if you have any other questions, and have a wonderful day.
Thank you, everyone. Bye-bye.
Thank you. And it's good night from here. Thank you.
Good night, Adinde. Thank you.
Okay, bye.